So today I'm going to be talking quickly about postpartum healing with vaginismus in relation to my first delivery, which was vaginal with an epidural. I did have some issues during my delivery. I had, some hemorrhaging, and I had some swelling postpartum, which was definitely above average. I wasn't able to sit for a long time, a few months, I want to say, without pain. And I also retained some injuries, which a doctor had told me was from my delivery, but those were not related to vaginismus, so I'm not going to get too into that. So postpartum healing was tough for me, but I don't think vaginismus hindered it in any way. Postpartum, you're not really doing inserting of much anyway in that area, so no tampons and things like that. So I don't think vaginismus is really just on my mind at all. It was not difficult for me to clean or take care of the area after delivery because of my vaginismus. I had a 2nd-degree tear and I had stitches, but when I went to my follow-up appointment for postpartum with my OB, she said that was healing perfectly fine. And she didn't really have to do too much of an internal exam. It was mostly just looking at it from the outside to make sure it was healing okay. So again, vaginismus wasn't an issue up to that point postpartum. Then a few months after I delivered, I did go to PT, and I was going to regular PT because of a lot of back problems, injuries I had retained, and they decided I needed more specialized care because that was postpartum, so they referred me to pelvic floor PT. So this was my first time going to pelvic floor physical therapy. My initial reason for going was for my injuries and my back problems I had retained that were affecting my daily function. At this point, vaginismus was secondary to me. I feel like I just needed to be able to function in order to be able to take care of my baby. So that was my mindset going in, but I think it was beneficial that she was also working on my pelvic floor because it could have been connected to my back pain as well. One of the things that she did for vaginismus was she asked if I wanted to do an internal exam. So that's when she inserts one finger and feels for tension in different parts of the muscles inside the vagina. And I did agree to this. I wanted to see if I could benefit from it and get the full, experience out of going to pelvic floor PT. What I learned was that I actually had 15% less pain than I did pre-delivery with the insertion of anything into the vagina. And I don't know if that was because of delivery, but it did take a few tries sometimes, and sometimes I wouldn't be able to relax, so it would take some time to ease into getting the internal exam. But overall, I feel like it hurt a little bit less in comparison to, say, tampons I've inserted previously, pap smears, and maybe an internal exam by the OBs that I have seen previously as well. So that was a nice surprise. I know some people are fully healed from their vaginismus through delivery, and I think that's amazing. That was not the case for me at all, but I do think there was a very slight improvement. And I don't know if it's completely related to that. I know vaginismus is physical and it's a little bit psychological as well. But yeah, I think pelvic floor PT is huge. I feel like for me, having vaginismus, if I could, I would have loved to go before trying to conceive, during pregnancy, postpartum, and continuing on with it to fully heal my vaginismus. I think sometimes it is a privilege to go because a lot of pelvic floor PTs are not in network with a lot of insurances in the US at least. So it can be a little bit expensive, but you can find pelvic floor PTs in network. It's just a little hard to do that depending on your insurance. Overall, pelvic floor PT was incredibly beneficial for me, but it did not heal my vaginismus. Upon discharge, I was given exercises to do for my vaginismus as well as for some of the back pain I was having. And I chose to make healing from my back pain a priority after discharge. So I was not working as much or as often as I could have been on the exercises for vaginismus. So I would say after that, my vaginismus was the same as it was upon discharge from PT. But I think that's about it. So if you have any questions, you can leave them below. And thank you so much for watching.